We're sorry. All of our representatives are still assisting other customers. Please remain on the line as we value your call.
Have you ever felt like a customer instead of a patient in a healthcare setting? Hi, guys. Welcome back to Beyond the Band-Aid. Today, we have four new guests joining us, Valentina, Amy, Roberta, and Michelle Miller. We will be discussing our experiences with the healthcare system and our outcomes with different social classes. If you can all introduce yourself and tell us a little bit about yourself.
Sure, I can start if you don't mind, Alejandra.
Of course, go right ahead.
Okay, so once again, my name is Michelle Miller, and a little bit of background about me is I'm a white woman born and raised in the state of California. I graduated with my bachelor's in public health from UC Berkeley, and after that, I stumbled into acting and starred on a couple of TV shows and movies. Although I'm not currently using my degree at the professional level, I do like to use it to talk about all the different health disparities in our country and what we can do to fix them. I'm really big on public health activism, especially because 15 years ago, I was diagnosed with heart disease. I got the quickest and best healthcare anyone could have ever received thanks to my acting job. The directors really pushed for me to be seen by the best doctors in California and for them to treat me quickly. It almost makes me feel guilty because I've had so many people tell me that patients with heart disease usually die within the 10 years after they're diagnosed, and that I'm so lucky. My eyes were already open to the unfairness in our healthcare system, but during that experience, I was getting fed up with all the inequalities that happen in our hospitals, doctors' offices, and more.
Thank you, Michelle. It is so exciting to have you here and to get to know about your experience dealing with heart disease and how your career and position has impacted your treatment. Roberta, what about you? Can you tell us a little bit about you?
Hello, ladies. First of all, it's a pleasure to be with you all today. I have a PhD in health policy, and I am an entrepreneur. I own various nonprofit businesses that allocate resources and support women facing HIV. I currently live alone and am not married. I identify as a Black Latinx woman, and even though I am currently successful, I used to live in the Mississippi Delta, one of the poorest regions in the US. That is where I was infected with HIV. It was during that time, when I was 18 years old, that I decided to start living a healthy and productive life for not only myself, but for the sake of others suffering with HIV as well. Looking back, growing up in dire circumstances altered who I am as a person today. My experiences have allowed me to put into perspective how valuable life is, and they also helped me grapple with the physical and emotional turmoil I've dealt with for so many years.
Thank you for telling us your experience, Roberta. It is truly inspiring to hear that you persevered through the diagnosis and created something motivating out of it. Amy, could you tell us a little bit about yourself?
Hey everyone, I'm so excited to be here talking to you all. I immigrated from China when I was 14. Living in the US was challenging for my family, as it was a big adjustment after coming from China, and we never had much money. I was married fairly young and have one daughter about to go to college, and my husband passed away a couple of years ago. Not long after I was diagnosed with renal disease. I wasn't taken seriously by a lot of doctors, and I didn't get the treatment I needed soon enough. My illness has progressed quickly into stage 4, but since I qualify for Medicaid, I'm able to get dialysis weekly. I'm currently working as a cashier at a grocery store in my neighborhood, but I'm worried about being able to send my daughter to college. I've been on the kidney transplant wait list, but I haven't made much progress in 2 years.
Thank you, Amy, for speaking about your experience with renal disease. It is incredibly enlightening because your experience shows that the state of our system and how it works. I truly hope that you can get your kidney transplant and soon you'll get all better. How about you, Valentina?
Before I start, I just want to thank you, Alejandra, for having me and all of you for giving me the chance to express my experiences and how they have shaped my perspective on healthcare. It has been a long journey, and those same experiences have how I felt about treatment, which overall affected my recovery from opioid addiction. I was born and raised here in Austin. My parents were Mexican immigrants who came here with the hopes of giving me and my younger siblings a better future. I had a lot going for me. I had amazing grades, and I was paving my way towards medical school. However, junior year of high school changed the course of my life. My father unfortunately passed away from a heart attack. This brought upon us a financial burden my mom could not handle. However, she persevered and took on 2 jobs to try and sustain my little brothers and me. I tried my best to take care of my brothers, however, at the same time, I couldn't handle the stress. I ended up dropping out of high school, which caused a disagreement between my mother and I. She wanted me to keep pursuing my dreams of going to medical school, however, seeing her struggle made me feel guilty. I convinced her I would start working and maybe someday when we were more stable, I would continue my studies. Unfortunately, finding a job as a high school dropout with no prior work experience wasn't easy. I started getting heart attack-like symptoms that led me to go to the hospital many times. It would turn out that I wasn't experiencing heart attacks themselves. My body was in a way trying to get around my dad's death. One thing led to another, and I started abusing substances. I at first justified it as me finding a way of coping with the loss of my father and my unfortunate circumstances, that if I wanted to, I could stop anytime. I couldn't, though. This led to my mom finding out and kicking me out of our home for the sake of my brothers. I then spent 3 years on the street with no job and with an addiction constantly worsening. However, I can now proudly say that I'm 6 months sober with a job and have reunited with my family. I have also picked up classes to get my GED and have been saving up so that one day I can take care of my family and put myself through medical school.
Thank you so much for sharing your story, Valentina. I'm so glad that you're doing so much better now and that you have been to be able to reconcile with your family. I'm so happy that you regained your motivation and have not given up on your sleep.
I appreciate that, Alejandra. Thank you so much for your kind words. How about you? What's your story?
I'm Alejandra Castillo, and I am a 37-year-old woman who has faced a significant health challenge from colon cancer. My journey began one day when I dined at a restaurant and experienced an uncomfortable bloating sensation afterwards. At first, I dismissed it as merely like a reaction to the food. However, my condition worsened and I fell ill, prompting me to take some over-the-counter medication in hopes that it would alleviate my discomfort. It wasn't until I noticed an alarming blood in my stool that I realized I needed to take my symptoms seriously. Without hesitation, I sought medical attention, and after undergoing a series of tests, the diagnosis was confirmed that I had stage 3 colon cancer. This news shocked me to my core, and I had to quickly process everything that lay ahead. I underwent surgery to remove the cancerous polyps. Additionally, I was prescribed medication to aid my recovery. Although I did my best to navigate the financial aspects by using my insurance to cover the cost of the surgery and medication, I discovered that only partially covered the expenses. As a result, my husband now bears a burden of paying the remaining balance out of pocket, adding to the stress of an already challenging situation. Does anyone think that our healthcare professionals see us as customers?
I do.
I do.
I do.
I do.
They absolutely see us as consumers. However, I'm not sure that we can blame them. It is ingrained in their lessons. When nurses and doctors and all other healthcare professionals learn about treating patients, they're taught to give them a band-aid and follow up to see if their patients got better. The system tries to avoid having an upstream approach because they know that if the patients are preventing their illnesses, they would be out of business. I've heard, however, that there are medical schools trying to implement an upstream approach that allows doctors to not only treat, but to find the root cause of their patients' illnesses. I especially learned about this after watching a TED Talk from Rishi Manchanda. I was able to be in that audience the day he gave his speech, and I and everyone around me was truly happy that someone is bringing this topic into the limelight.
Oh, that's interesting, Michelle. We all like to think that you'd had a better relationship with healthcare professionals due to your celebrity status. Could you elaborate a little bit more on that? On what do you mean?
Yes, Alejandra. I mentioned earlier that I got the best care, but I do not believe that it was in my best interest. I felt like the doctors only saw me as an opportunity for quick money because of my social status. They know that my bosses and movie directors would do anything to see me well as quickly as possible because they have a show to finish. I was just a quick money grab to them, and they all had a downstream approach when they were treating me.
I see what you mean, Michelle. I sometimes feel as though my doctors don't act in my own best interests. There was a period in my life where I didn't trust my doctors at all, and most of it had to do because I am a Black woman. They don't take us seriously when we talk about pain and our experiences with it. Often, I would feel victim blamed by doctors, and for a long time, I started to buy into the downstream approach, which sets the blame on individuals engaging in risky behaviors, leading to the development of many diseases. At the time, I didn't know what an upstream approach to disease was, and it prevented me from understanding how upstream solutions continually act as the root cause of exposure to disease. Ever since I went to college and realized so many different medical frameworks exist for explaining the cause of disease, I came across Lincoln Phelan's work, an article titled Fundamental Cause Theory. Lincoln Phelan's work focuses on the fundamental causes of disease by contextualizing risk factors and highlighting the difference between upstream and downstream approaches. This framework instantly caught my eye since it focuses on issues of socioeconomic status such as social class, income, education, racism, gender, and political public health policies. All these socioeconomic factors disproportionately disadvantage vast racial and ethnic populations. If I had known this when I was first diagnosed with HIV at 18, it could have avoided so much pain and suffering. It really does take a toll on your own mental health to not be able to share common experiences and the burden of carrying the effects of this disease when it comes to coping with the reality of it.
It's interesting that even though we're all different people with different socioeconomic statuses and health circumstances, we all find ourselves feeling the same way as patients. Based on my experience, I felt like as soon as my nurse or doctor found out about my history with opioid addiction, their interest in understanding my circumstances would fade. My symptoms, no matter what they were, would be excused with my substance abuse history. I will also say that my treatment has vastly changed from when I was dealing with my addiction versus when I started being sober.
What do you mean by that?
Like I explained before, I went through a period where I started getting symptoms that were very similar to heart attacks. Unfortunately, these symptoms got worse when I was deep into my addiction. I would go to the hospital to get myself checked out. However, I felt like my symptoms weren't taken seriously and were ignored as soon as they found out about my struggles with my addiction. Many times I would walk out feeling guilty and I would blame myself for not making better decisions. Unfortunately, this would cause many relapses throughout that period of my life. That's why I believe that there should be a bigger focus on finding the root cause of these issues and putting more energy in finding solutions or preventative measures. There are many people out there suffering from things that go beyond the physical or the medical issues are being amplified by non-physical factors. I know it is easier said than done, but I think we can all agree that we can't simply continue to treat an illness as is and hope it never happens again.
Absolutely. It is something that needs more attention. We need more doctors that are more willing to go out of their way to look beyond the medical terms. What about you, Amy? What are your thoughts?
I completely agree with the idea that the doctors are really just trained to take care of the problems they see without ever really addressing what might actually be causing them. When I lived in China when I was younger, I was used to having good health care, as well as issues with doctors trying to really understand their patients. While most of the doctors were all very well trained, they're also expected to treat issues they see and don't really listen to what the patient is saying. When I came to the US, it was normal to see doctors and medical professionals disregarding my pain and just putting a quick band-aid on and sending me away. When I first started getting symptoms of renal disease, I felt like my doctors thought it was in my head, and they didn't seem to really try to get to the root cause of my issues, which is partly why my disease progressed so fast because I didn't get the medical attention I deserved. I also felt like having healthcare in China was so much easier than here, and struggling to get Medicaid here made my treatment for my renal disease so much more challenging. I feel like as a society, we need to understand where medical issues start in order to address them, and medical professionals must learn to take a more upstreamist approach, looking for social causes of certain diseases and illnesses.
Talking about healthcare accessibility, it reminds me of an article I recently read titled The Association Between Income and Life Expectancy by Chetty et al.
Oh, yes, I know it. I remember reading that. Someone sent me that article, and it was immensely powerful in its words. It seems as if disparities themselves go beyond just our socioeconomic status. The article talks about how looking at a national level does not give the most correct picture because there are differences in outcomes in the local level between income groups. This brings a question of why some people suffer more in some areas than others. In my case, I come from California, and I've seen areas where healthcare is easily accessible to everyone. But unfortunately, in other areas, they seem to only serve those of the higher class because the level of treatment is different.
That's very interesting. Moving to Texas from China was such a different experience, especially seeing how living in one area of Texas rather than another can so easily affect your way of life. Living in a difficult area of Austin has cut me off from a lot of resources that people in other areas might easily have access to, and that makes it really hard for me to eat healthy and take care of myself. Also, depending on where you live, access to medical care can be vastly different, as you could live somewhere where doctors are extremely helpful in giving medical care, or you could live somewhere where doctors are scarce, which cuts you off from good medical treatment.
I think it's very interesting to see how, even though we all come from different socioeconomic backgrounds, races, and ethnicities, and would seemingly have not much in common with each other, we all relate to our collective health experiences that disadvantage us in unique ways. As I mentioned before, I struggled immensely growing up in one of the most unresourceful places in Mississippi. I think a lot of the time, medical practitioners and even people in general like to think that a person brings hardship onto themselves by design. This completely undermines the social forces at play, such as lack of knowledge and power over situations, ignoring how geographic location and environmental conditions shape our daily lives, producing detrimental effects.
I would also like to highlight that it is interesting that even though we all live in the same country, the area that you live in has a big impact on the outcome of your well-being. It is heartbreaking to hear that there are populations who can't get the help or treatment they need unless they travel elsewhere. This brings me to wonder how many people out there could have been helped if resources were equally available across the country. As someone who has dealt with substance addiction and homelessness and has friends who have dealt with the same circumstances, I can't imagine how the course of our journey could have differed if only we lived elsewhere. Maybe our circumstances would have been taken more seriously. There are many things that I feel like contributed to my addiction. However, I can't help but wonder if the course of my life would have been different if I would have been able to have found a job back when I first dropped out of high school. Maybe I would have felt less helpless and would have been able to develop a sense of purpose to continue trying.
I think that's a perfectly understandable thought process. I'm glad that you brought up the factor of employment because it reminds me of a concept called death of despair. Have you heard of it, Michelle?
Yes, I have. The phrase that was coined by Anne Case and Angus Deaton, correct?
Yes.
That sounds interesting. What is it about?
So Case and Deaton are economists that came up with the phrase deaths of despair to bring up the shocking increased mortality rates that are shared by non-college educated white working class individuals. Case and Deaton noticed that the communities that these individuals are living in are economically bleak. They experience economic stagnation. In other words, low wages and less stability, which leads to suicide, alcohol-related deaths, and overdose deaths.
I can really relate to this, especially because my husband, who passed away a couple of years ago, fits exactly into this category. Like me, he never went to college, so naturally it was hard for us to make ends meet. The environment we raised our daughter in wasn't a great one, and because of this, we had so many limited resources. We didn't have access to quality food, medical care, or even good housing, much like Cancer Alley and other areas of the US that have significant environmental stressors. There weren't many good schools in the area for my daughter to go to, and we often worried about her safety. It caused us to be really stressed and worried about our family's well-being. The neighborhood we lived in wasn't good, and there was a lot of drug and alcohol abuse, which my husband somewhat became involved in. He started drinking frequently, and this contributed to his death a couple years ago of heart disease. I think that the ability to go and complete college not only sets up people for better jobs, but also allows them to live in better environments that give them better access to medical care and better quality of life in general. I think that the way our society is set up restricts people who haven't completed their education, like my husband and myself, and prohibits them from living long, healthy lives.
That is awful, Amy. I'm so sorry to hear it.
Thank you, Roberta. I think it's something really near and dear to my heart. I think that a lot of people kind of skip over the fact that your environment is a huge contributor to your health in more ways than one. It's super important that we talk about this because it makes people more aware of how low education, as well as low wages, can cut access to so many important things.
Yes, so sorry to hear about your husband, Amy. And I think you are right to bring up how environment is a huge contributor to health. Now that we've heard about quite a bit of health disparities all around America, what do y'all think the fact that our OECD peer nations are outperforming us in life expectancy rates?
What's an OECD per nation?
Alejandra, if you don't mind, I would love to explain how our OECD peer nations are outperforming us by discussing an article by Avendano and Kawachi.
Go for it.
Okay, the OECD is the Organization for Economic Cooperation and Development, and it houses 38 countries, America being one of them. According to Avendano and Kawachi in their article of Why Do Americans Have Shorter Life Expectancy and Worse Health Than Do People in Other High-Income Countries, we always perform worse when compared to our OECD peer nations in terms of mortality. They explain that there are ethnic, racial, and socioeconomic disparities that contribute to the disadvantage of the United States health. Our OECD peer nations also have a greater deal of social nets, like financial assistance with medical care, better educational policies, and just overall better policies for their people.
I find it interesting they talk about the contribution of social inequalities and the lack of social nets contributing to life experience. Based on my experience, I do feel like there is a correlation between socioeconomic status and access to healthcare, which may lead to disparities in the access to healthcare. I think that's where social nets become incredibly important because those nets are what help balance access to healthcare. I think seeing our OECD nations is just proof that there is a need to prioritize social policies that deal with better education, better healthcare access, and income support.
I completely agree. I think seeing how poorly we're doing compared to our OECD peers can open our eyes to the fact that we need to do things such as make education more affordable, which would allow for more people to have better access to jobs. We also need to work on improving our access to healthcare, specifically making it more equal for those that aren't able to have access. We also need to keep in mind that overall, the US has a much worse quality of life than other OECD countries, and our individual habits have a lot to do with that.
Obviously, it's important to talk about individual behaviors and their role in fostering disease for minority groups. Yet we cannot forget the importance of our own environment, putting us constantly at risk to engage in unhealthy behaviors. Take smoking, for example. Avendano and Kawachi explain how the lagging US life expectancy is associated with older women who smoke. Now, as individuals, we could play the blame game all we want, especially when it comes to women, but that wouldn't do anything in understanding why they are engaging in this type of behavior. Many are unaware that women who smoked regularly were often targeted as consumers and were encouraged early on in their lives to foment this destructive behavior. Avendano and Kawachi truly do an immense job at explaining how this phenomenon is concurrent with many other individual behaviors, such as smoking and unhealthy eating. Linking the development of disease through social and demographic factors is crucial in explaining health outcomes for people with many different backgrounds.
Here with all of you, especially with how much money the US spends on healthcare, yet we're still very far behind in properly addressing healthcare. All right, it looks like we're all out of time. Thank you, ladies, so much for joining me today.
Thank you, Alejandra, for inviting us to your podcast.
Thank you so much. It's been an honor to have gotten to converse with you all.
Thank you so much for the opportunity to talk about this. It's been amazing to get to talk with you all and learn about your different experiences with our healthcare system.
It was lovely meeting everyone today. And thank you so much again for inviting me on your podcast, Alejandra.
It has truly been a pleasure meeting all of you. I wish everyone the best of luck navigating this sick care system. As for my listeners, thank you for listening and for the continued support. Make sure you take care of yourselves and the people around you, and most importantly, keep looking beyond the band-aid.